If you're suffering from digestive issues, leaky gut just may be the cause of it. So let's figure out how to diagnose it today. Hi, I'm Dr. Ariane Missimer. I'm a functional medicine practitioner, a doctor of physical therapy, and registered dietitian. And today we are going to talk about what leaky gut is, what are some of the symptoms, and most importantly, how can you get to the underlying causes of your potential leaky gut. So what is leaky gut? So we want to think about our gut lining as our epithelial lining of the small intestine. This is like a protective barrier. So when we're thinking about leaky gut, otherwise known as intestinal permeability, we can have these tight junctions in this lining of our gut that is acting as this protector to allow for proper nutrient absorption and of course digestion in the small intestine. What we want to have happen is water and nutrients are moving freely into the bloodstream, but we don't want the other things like pathogens and undigested food and toxins. And so when we have a breakdown, or i.e. a leaky gut, then we can have these things moving into the bloodstream. And what happens at this point is then our immune system responds to that because it's not supposed to be there. So this can cause widespread inflammation in the body that can contribute to a whole host of different conditions. So what are some of the symptoms of leaky gut? Of course, the common symptoms you may experience are digestive symptoms. So this could be falling under the category of IBS, irritable bowel syndrome. So you may have things like gas and bloating, reflux, constipation, diarrhea, symptoms of indigestion. But you also may have things like undigested food in your stool. You may have more food sensitivities and intolerances and even allergies because of what can happen as it relates to leaky gut creating an immune response that is associated with excessive or persistent inflammation. So because of that, we can also have a whole host of other general symptoms. This can cause things like chronic pain, chronic fatigue, brain fog, loss of concentration. It can also be associated with localized pain like knee pain or shoulder pain. It could be associated with things like autoimmune disease, where we have this significant immune response where our immune system is really responding to our own tissues or cells. You can also have things like skin issues. So this could present as eczema or autoimmune psoriasis, or even just simply dermatitis that could present rashes. Let's not forget mood and cognitive health. So it can be associated with things like maybe ADHD or anxiety or even depression. It can be associated with nutrient deficiencies because there is a link between dysbiosis and leaky gut. So in essence, it can be challenging because there are so many symptoms that can be associated with leaky gut, i.e. intestinal permeability. Okay, so what causes leaky gut? One of the things that has been shown to be associated with leaky gut is dysbiosis. Essentially, that is an imbalance of bacteria in our microbiome. So we want to have just the right amount of beneficial bacteria, but we also don't want to have an overgrowth or a lot of opportunistic bacteria that are contributing to certain health conditions or even associated with autoimmune disease and excessive inflammation. Number two is antibiotics. So this might seem a little more obvious because, as we know, when we take antibiotics, even just one round of antibiotics can have a significant effect on our microbiome. So that will in turn create or contribute to dysbiosis in the gut, perpetuating or leading to leaky gut. Number three is a pro-inflammatory diet, is also something that can trigger and or perpetuate leaky gut. We also want to think about stress. When we have increased cortisol, that is not only going to decrease blood flow to the digestive tract, slowing down our digestive capabilities, but it is also increasing inflammation, which can therefore contribute to leaky gut. Maldigestion, so any breakdown in our digestive capabilities. So that could be things like lack of chewing, that could be decreased pancreatic elastase, that could be decreased stomach acid. All of these things can create a downstream effect of increasing bacteria into the small intestine, and that dysbiosis can then perpetuate the cycle. And let's not forget chemotherapy and radiation. These are things that can have a profound effect on our gut lining. And even things like poor sleep and overexercising, anything that can create a decreased ability to repair and recover, but also a potential increase in inflammation can ultimately have a potential effect on our intestinal permeability. So as you can see, there are quite a few things that can either directly or indirectly influence the gut. So how can you figure out the root causes of leaky gut? So unfortunately, there are no validated tests at this point for leaky gut. However, there are a lot of different tests that you can do to really understand what your symptoms are they associated with leaky gut, and how to treat it, of course. So the first thing that we want to think about is your clinical presentation. So I went through a lot of different symptoms that you may experience, but one of the things that I'll say just from working with a lot of patients is that most people that experience signs of leaky gut have multiple things happening. They may have increased food sensitivities or allergies or intolerances. They may experience more inflammation, multiple joints hurting. So when they come in, they might have shoulder pain, and they might have neck pain, and they might have back pain, and then that gets better, and then something else happens. So when we start to see these different things that are happening and nothing is showing up on your standard lab testing, this is where we want to start to look a little bit further into potentially leaky gut. So how to do that is looking at that clinical presentation first. Always, I think that's the most important starting point with you and hopefully your practitioner. Then you can start to think about what are the things that you want to test for to understand what might be happening. And sometimes that may mean ruling things out. So we want to start with things like, of course, looking at your basic labs, your CBC, your CMP, but then looking a little bit deeper, looking at things like some of your inflammatory markers. So you could look at sedimentation rate. You could look at high sensitivity C-reactive protein. You can also look at things like an ANA and looking to see, is there any potential autoimmune disease that's happening? But once again, we want to think about what is the root cause of your autoimmune disease. So being able to get a better sense of looking at some inflammatory markers and also looking, of course, at nutrient deficiencies. So we want to look at things like vitamin D, vitamin B12, looking at, let's say, your iron to see how are you absorbing maybe the nutrients that you're eating. And then you can start to get a better sense of what's happening from a overall perspective. Now that you have that, you can once again look a little deeper. This is where I think the most valuable test is the GI map. You can of course use other stool testing such as the comprehensive Genova stool test, but I think the GI map is very, very helpful in understanding what is happening in the gut microbiome. And it also has a specific marker to look at zonulin. Zonulin is a protein that holds those tight junctions together. When the zonulin is increased, that is indicative or suggestive of potentially leaky gut. Now, once again, there's no validated test, but when you're looking at a complete picture of the elevated zonulin in a GI map test and you see dysbiosis and you have the clinical presentation of leaky gut, then you may be able to get a better understanding if this is what's happening to you. So when I see increased zonulin on a GI map test as one of my add-on tests, I will look to see what are all the things within even the stool test itself that are contributing to that. So I don't necessarily look at that as the diagnosis, but I'm looking to see what are all the things that might be contributing to that. So is there dysbiosis? Is there a parasite? Is there H. pylori, an infection? Is the secretory IgA, the immune system of the gut, elevated? So what are some of the other things that might be contributing to the increased zonulin? And that's where you can really start to get a better understanding and a complete picture of all the things that may be associated with your current condition. As always, I hope that this was helpful in you understanding a little bit more about your gut, your digestive issues, and your overall health. If you want more videos on root cause medicine, make sure you subscribe to our channel.